And so with that, I would like to introduce our first speaker. Our first speaker today is Alejandra Ros Pilars. Dr. Pilars is an assistant professor at the Sandra Rosenbaum School of Social Work at UW-Madison. Her research examines how parental employment and children's early care and education experiences matter for child development. She is one of the lead investigators on a UW-Madison research team that is partnering with the Wisconsin Department of Children and Families to study Wisconsin's early care and education workforce and changes in the supply of early care and education in the state. Her other research projects focus on mothers' employment and child and family well-being and are funded by the National Institutes of Health and the Russell Sage Foundation. Today, she will discuss emerging data in Wisconsin and what it reveals about the supply of childcare in the state, as well as the people who are providing that care. Dr. Pilars.
Thank you so much. I'm happy to be here. I'll go ahead and share my screen. Okay. So today I'm excited to be talking about early care and education in Wisconsin. And some of the data that I'm going to be showing you come from two projects that were conducted in partnership with the Wisconsin Department of Children and Families from the Preschool Development Grant and the Child Care Policy Research Partnership. Both of these funded by the U.S. Department of Health and Human Services with the goal of improving ECE systems in the state. So I'd like to gratefully acknowledge staff at DCF and the research team at UW-Madison, which is led by Amy Cleasons, Catherine Magnuson, and myself, for the hard work that went into generating some of the data and findings that I'm going to be talking about today. Okay, so before I dive into the state of early care and education in Wisconsin, I want to remind us all about why ECE, or early care education, is so important and why we're talking about it today. There's a wealth of evidence that high quality and affordable ECE promotes children's development, parents' ability to work, and ultimately fuels the economy at large. Children who attend high quality ECE, especially children from families with low incomes, do better in school, are more likely to graduate high school and attend college, and also tend to be in better health and have higher earnings in adulthood. And these gains in turn have positive spillovers to the economy and society at large. High quality and affordable ECE is also critical for parents, especially mothers' ability to work. When ECE is unavailable or parents feel it's unsafe, they leave the labor force. And this results for parents in lost earnings in the short term and a lower earnings trajectory in the longer term when they do eventually return to work. But this also negatively impacts the economy when employers can't find enough workers or have increased turnover in their labor force. And parents were leaving the labor force due to childcare costs and availability pre-pandemic, but this has likely only gotten worse due to an increased shortage of providers who have left the field. And what do I mean by high quality early care and education? So high quality care is characterized by the quality of the interactions between children and their caregivers, as well as the provision of safe and stimulating environments that have age-appropriate materials for children to explore. Children thrive when their caregivers are sensitive and responsive to their needs and engage them in ways that stimulate their learning and curiosity about their environment. ECE providers are the most important ingredient of high quality care. But high quality ECE must also be affordable so that families can actually make use of it. So when I talk about ECE, I'm referring to a few different types of settings that I want to briefly explain. So the center-based care sector includes private centers, state and locally funded pre-K programs or pre-kindergarten programs, and federally funded Head Start programs, which serve low-income 3 to 5-year-olds. And then we have the home-based care sector, which breaks down into 3 different types of settings. So licensed family childcare providers have a license to care for a small group of children in their own home. Individual non-relative providers, like nannies, usually care for 1 or a few children in the child's home or in their own home. And then children's relatives often also provide regular care, often unpaid. And each of these settings can provide high quality care, but licensed settings and center-based settings tend to be on average higher quality than unlicensed or unregulated settings. By the time they enter school, the vast majority of children will have attended an ECE program. And at a given point in time, 50% of infants and toddlers and 63% of 3 to 5-year-olds participate in a regular ECE program. This is what children's participation in ECE looks like at the national level. We don't have Wisconsin-specific data on this, but what you can see here is that the type of ECE varies by child age. So only 25% of infants and toddlers, compared to nearly half of preschoolers, are in a center-based ECE program regularly. An additional 4% of infants and toddlers and 12% of preschoolers are in a combination of center-based ECE and care by an unpaid individual, vast majority of which are relatives. But with respect to home-based care, you can see that a majority of infants and toddlers are actually in a home-based setting compared to only 29% of preschoolers. And these differences in type of care by age are likely driven both by supply and demand factors. So some parents prefer a home-based setting when their children are very young, but also the supply of center-based care is much higher for preschoolers than infants and toddlers. Households with children under age 6 who use regular ECE spend about 20% of their income on this, but families with lower incomes spend a greater percentage of their income on ECE. So poor households spend a third of their income on ECE. Okay, so now I'm going to switch gears a bit to talk about what we know about access to ECE in Wisconsin. So what this map shows you is geographic access to ECE for families with children under age 5 as of February 2020. So this is before COVID, and when we know that some providers have closed since then. So ECE in this map includes all regulated childcare providers, including, as I just mentioned, licensed centers, licensed family childcare homes, and individuals who are regulated by the state to provide care to small groups of children. Each dot on the map represents one household with children under age 5. The blue and green dots represent adequate access to regulated childcare, meaning at most 2 to 3 children per regulated slot. Orange and red dots represent areas with what we call childcare deserts, meaning low access to ECE. This means that there are 3 or more children per childcare spot living in that area. So what you can see from the map is that children and families tend to be concentrated in more urban areas. You see many more dots around urban centers, like around Milwaukee and Dane County. But you can also see that supply and demand tends to be more balanced in these areas, meaning there's more blue and green dots. So we know that on average, there are about 1.7 children per spot in urban areas compared to 3.4 children per spot in rural areas, especially in areas outside of rural town and village centers. And again, I want to remind us this is before the COVID-19 pandemic, which we know has led to some provider closures and likely a decline in supply. And then the other thing to know is that this only tells us about geographic proximity to ECE, but doesn't tell us whether the ECE is affordable or high quality. So I just showed you what access to ECE looked like right before the pandemic. And now I'm going to talk a little bit about how the supply of ECE has changed over the past 15 years, between 2005 to 2019. And this can help us understand if access might be getting better or worse over time. And here we're focusing on licensed ECE supply, which includes licensed childcare centers and licensed family childcare providers. So this gray line shows you that the overall in the state, the supply of licensed ECE has remained fairly stable. This shows the number of licensed slots. You can see that it's fairly close to what it was in 2005. So decline of only 1.6% of slots. But this really differs in the center-based capacity has actually increased, this orange line, by about 10%, whereas this blue line, the licensed family childcare capacity, has actually declined by 51%. And what I'm showing you is licensed capacity, so number of children that programs are licensed to care for, but this is likely an overestimate of the number of children actually being served because we know that some programs operate under capacity or under enrollment, either because they can't find enough children to fill those slots or because they can't find enough qualified teachers to care for more children. And so what I'm showing you as this figure is this, again, the changes in licensed ECE supply over time, but I'm showing the percent change in licensed capacity. So this is for the state of Wisconsin, the change in all licensed capacity. The orange bars are the change in licensed center-based capacity, which you see increased. And then the gray bars are the change in licensed family childcare capacity. So what I want to point out here is that we see different patterns by region and by rurality. So in the northeastern, northern, and southeastern regions, we actually see the decline in capacity similar to overall in the state. But in the Western and Southern regions, we actually see an increase both in total capacity and an increase in center-based capacity. By comparison, in the rural counties in the state, we see an overall decline, a 20% decline in total licensed capacity, driven both by declines in the center-based sector and in family childcare providers. You can see by these pretty large gray bars that the decline in licensed family childcare is occurring in all regions and all counties in Wisconsin. So to try to better understand these trends, we looked at the number of providers that opened and closed in a given year. So this figure shows you the number of licensed family childcare providers that opened in a given year, that's the blue bars, and that closed in a given year, and those are the orange bars. So what you can see is that before 2009, the number of family childcare providers that opened and closed was fairly even. The bars are similar heights. But starting in 2009, many fewer providers opened than closed in a given year. And this is what is driving this decline in family childcare capacity. So what this suggests is it's important to pay attention not only to retaining current providers, so minimizing closings, but also to encouraging more providers to enter the field. And I'm showing you the licensed childcare center openings and closings just for comparison, so you can see that in this more stable sector, there's been a similar number of provider openings and closings each year. Okay, so what are the implications of these trends that I've just showed you? Well, we see that it's a decline in rural counties and northern parts of the states in licensed childcare capacity, which means that families in these regions are more likely to live in childcare deserts with lower access to ECE. And this is consistent, again, with what I showed you with that map of geographic access to care that shows lower access in those parts of the state. The large decline in licensed family childcare most likely impacts families who rely on this care the most, including families with infants and toddlers, families with lower incomes who can better afford family childcare, which tends to be less expensive, families in which parents work during non-standard hours outside of 9 to 5, Monday to Friday, because family childcare providers are more likely to provide care during these times, families of color and immigrant families who are more likely to live in childcare deserts, and families living in more rural areas who also have less access to care and less access to center-based care. So the decline in licensed family childcare means that parents who depend on this type of ECE might be either leaving the labor force or putting their children in unregulated and potentially lower quality settings, which in turn has negative implications for parents' employment, for children's development, and for the local economy. And I want to point out that while we see relative stability in the center-based sector, this likely masks instability within childcare centers in terms of teacher turnover. So when a family childcare provider decides to leave the field, we observe this in our data as a family childcare closure. But when a center-based ECE teacher leaves the field, the center experiences turnover, which also negatively impacts children and families, but that is not something we can actually observe in these data that I just showed you. However, we know turnover is likely substantial, and Anna Markowicz will talk much more about this next. Okay, so what might actually explain some of these trends that I just showed you? Well, we don't know exactly why family childcare has declined in Wisconsin, but one of our ongoing research projects aims to address this question. So we hope to have more to share on this soon. But we do have some hints from prior research as to what factors may be playing a role. So as you likely know, Wisconsin has an aging population, and a decline in the number of kids needing care could be contributing to a decline in family childcare. But the decline is large enough and across all parts of Wisconsin that we think this is unlikely to be the sole or the main explanation. We also know from a study of family childcare providers who left the field, which was conducted in multiple states, that providers describe multiple factors that contribute to their exit, including costly and burdensome requirements from licensing and childcare subsidy systems, low subsidy payment rates, and unstable enrollment of children, which make their business unsustainable over time, as well as having limited benefits and experiencing difficult working conditions. And we know that during the period of our study, Wisconsin, like other states, has increased regulations for providers in an effort to improve the safety and quality of ECE, and also significantly expanded the 4-year-old kindergarten program. And although these changes are ultimately good for children and families, they increase costs for providers at a time when the value of subsidy reimbursement rates were declining and when providers' wages were and have stayed very low, especially compared to other employment sectors. So it's likely there's a combination of these factors at play, and we'll have, as I said, more to share on this question soon. But what we do know right now is about the current state of the ECE workforce and the challenges that they're currently experiencing. So that's what I want to talk about next. So in the fall of 2020, spring of 2021, we conducted a series of studies on the Wisconsin ECE workforce, including a survey of center-based ECE teachers and a survey of family childcare providers. So what I'm showing you here is who works in ECE. So what you can see is that vast majority, nearly all of the workforce is female, 98% of ECE teachers and 100% of family providers in our survey. The racial and ethnic composition of ECE teachers mirrors that of the state of Wisconsin, but family childcare providers are disproportionately likely to be women of color. We also see that they are both ECE teachers and family providers are highly educated and experienced. So 83% have some college education, and between 42 to 48% have an associate's or bachelor's degree or higher. ECE teachers have on average 7 years of experience in the field, whereas family childcare providers have double that, about 15 years of experience. Also consistent with them being older, their median age is 51 years compared to 34 years for ECE teachers. Despite these qualifications, however, the ECE workforce is low paid. So you can see over here, I'm showing you median wages for licensed family childcare providers, for center-based ECE teachers, compared to Wisconsin workers with a high school degree. So what you can see is that given the hours worked and the income that they report, licensed family childcare providers earn on average $7.46 an hour, which is just above the $7.25 minimum wage in Wisconsin. ECE teachers earn nearly $13 an hour, but are still much lower paid compared to Wisconsin workers with a high school degree. And remember that I just told you that 83% of ECE workforce has more than a high school degree. The workforce also has limited access to benefits. So only 1 in 5 ECE teachers receives health insurance through their employer, and 1 in 4 family providers say that they're able to purchase their own health insurance. You might think this is okay because they're getting insurance through other sources, and some do report getting from their parents, spouses, from Health Insurance Marketplace or Badger Care. But 12% of ECE teachers report having no health insurance, and 8% of family providers have no health insurance. These working conditions contribute, at least in part, to ECE workers' dissatisfaction with the ECE field and job. So when asked when they plan to leave the field, 18% of family childcare providers and 28% of ECE teachers say that they plan to leave within the next 2 years. And an additional 20% in both groups plan to leave within 5 years. So that means that nearly 50% of ECE teachers plan to leave within 5 years. Family childcare providers are more likely than teachers to say that they plan to leave the field due to retirement. Across both groups, the most common reason for wanting to leave the field, other than retirement, was to find a job with better compensation or with more opportunity for advancement. And maybe not surprisingly, then 28% of ECE teachers report having looked for a new job within the past 6 months. And 22% of ECE teachers have been in their current job for less than 1 year, suggesting potential substantial turnover within the field. Okay, so I want to address, to sort of wrap up this question of why are ECE workers' wages so low, as I just showed you, when care is unaffordable for many families. So the main reason is ECE is a labor-intensive service. So ECE workers, as I mentioned, are the most important ingredient of high-quality care. So a vast majority of expenses for childcare centers and family providers go towards salaries. But programs have lots of other expenses too, and they operate on razor-thin margins. To illustrate this, I'd like to show you a hypothetical infant-toddler classroom in Wisconsin. So per licensing rules, this classroom could have up to 8 children and a 1-to-4 child-to-teacher ratio, meaning they would have 2 teachers in the classroom at all times. In this scenario, the classroom is open for 10 hours per day, so that means they would need to pay 2.5 teachers per day. At $12.99 an hour, the median wage for ECE teachers in Wisconsin, this would equate to wages, the center paying $67,500 in wages per year for teacher salaries. This breaks down to $8,500 per child or $700 per month per child. But centers have other expenses too, including administration, rent, maintenance of the building and outdoor air spaces, materials for children, food, and benefits for their staff. If we assume that programs are spending 70% of their budget on teacher salaries, which is somewhat generous, this means they would have an additional about $29,000 to spread out over all these additional costs, which would break out to $300 per child per month. This means that the annual cost to operate this classroom would be about $96,500, which equates to $1,000 per month per child. And this is pretty similar to what we know about what families pay on average for infant care, which is about a little more than $10,000 per year at the national average. In Wisconsin, prices for infant care range from about $9,000 to $14,000. This is about a middle of the range costs of infant care. So as you can see, ECE is expensive because caring for children is labor intensive. And this means that when programs want to pay their teachers more, they have little room to cut for other expenses and have to end up passing this on to families. Okay, so to wrap up, a few key takeaways from what I talked about today. So we saw that geographic proximity to ECE varies widely across communities in Wisconsin, but access tends to be better in more urban areas. The licensed ECE supply has been fairly stable over time, but the number of licensed family childcare providers has greatly declined. We know that the ECE workforce is experienced, educated, and committed to the profession, but they experience low compensation and challenging work conditions. Turnover within the field, ECE field and within programs is likely substantial, and providers are dissatisfied with the conditions in the field. So overall, these conditions threaten ECE providers' ability to provide high quality care, parents' ability to work due to a lack of high quality care, and ultimately children's development. But the good news is that we don't have to accept things as they are, and there are promising strategies for improving conditions in the ECE field. And our next speakers will be talking more about these solutions. Thank you very much.
Thank you, Alejandra. So for everybody, we have 3 minutes for clarifying questions for Dr. Pilars. For those of you who joined late, please submit your questions at any time throughout the seminar using the Q&A button at the bottom of your screen. So I do just want to mention that we will have more time for Q&A at the end as well after all of our speakers have presented. And Alejandra, we did have one question for you that came in from Representative Brostoff. What state is excelling in this area? Or states, and could you describe maybe some of the best practices that are out there at this point?
Yeah, I think that's probably a better question for after Joanne talks, just because I think she'll lay out some of the strategies that are working, and maybe we'll take a bit of a longer discussion to answer. But I'm not sure that there's definitely states who are trying different things, including Virginia, which I think Joanne will talk about. So I think if we save that for later, that might provide a better answer.
Yes, and thank you for foreshadowing that. As Dr. Pilars mentioned, Joanne Shui, our third speaker, will be diving into policy solutions in a lot more detail. We have another question from Senator Bewley. Are you observing more men entering the field of childcare, as is seen in nursing?
Not that I know of. As I said, we conducted this survey of ECE teachers and family providers pretty recently, so I guess about a year ago. And the workforce is really nearly all female. I don't think that has changed in the last year. We know that providers have been having a harder time during the pandemic recruiting highly qualified staff, so I don't think that we're observing more men or women really entering the field than in the past.
Thank you. And that is all the time we have for clarifying questions at this point. Again, we will be circling back for other questions later on.